typically work in the children's hospital. However, I do have colleagues that work in the adult hospital as well, and I've done some things there. But because I work through the Children's Miracle Network, which is a funding agency that supports a lot that happens in the children's hospital, so they fund my job, so that's why I work with pediatrics. So I work in pediatric intensive care, which is where a lot of our traumas go, in the intermediate care unit, which is like a step-down unit, see a lot of trach kids there, and then our general acute pediatrics, which is like your in and out, your post-appendicitis, post-surgery. A little bit about me, I did graduate from Conner Weiser back in 2011. I went through the ag department, did a lot of the music department and the drama department. It's wonderful what they offer now. I wish I would have had this experience when I was here. So neat to see so many of you. All right, so click it. Get those instruments around if you haven't gotten them around yet. Give it another minute. I want you to put on your pediatric hat as I spill my water. Pretend that you're in the hospital. Maybe you're stuck there for a few days. Maybe you have a lot of pain, or maybe you're missing your family. Just kind of create a story in your head. And if you want to stand up, you can stand up. If you want to play your instruments, you can. We're just going to get moving here a little bit this morning. I know you all have been here a little bit in the Summer Research Institute. You're probably tired from your last day. Maybe you're excited. But if you want to get up and move the mic guitars to me out too, I apologize. All right. Play your instrument however you want. We're going to play our instrument today. Play our instrument today. Play our instrument today. Play together, that's all right. All right, I need a volunteer. Any volunteer? Oh, I know, it's early. I'm usually doing this like 8 in the morning. If anyone volunteer. Oh, yes. All right, tell us how we should play our instruments. Okay, so we all have percussion instruments. We can't play them in a higher key. But, I mean, I can play in a higher key. So we'll play in a higher key. And how should everyone play their instruments? Really? What is it? Quicker. All right, ready? We're going to play our instruments today. Play our instruments today. Play our instruments today. Play a little quicker. I don't need no quicker. A little quicker. There we go. Quicker. All right, I need another volunteer. All right, I'm going to give you one. So everybody needs to stand up for this one. We're going to spin in a circle today. Spin in a circle today. We're going to spin in a circle today. We're going to spin while playing your instrument. All right, think you're a little more awake. Maybe. A little bit. All right. You can set your instruments on the floor if you want, if they're going to be distracting. We might come back to them a little bit later. I want you to think about what was going on for you during that experience. It can be anything. There's no right or wrong answer. What were you doing with your body? What were you thinking? How are you feeling?
We were all laughing.
Yeah, there was a ton of laughter going on here. I saw some smirks from the people that weren't laughing. Okay, so we were brightening a little bit. Our affect, we call that our affect, was brightening. What else is going on? What's going on physically? You still as important? No. Moving. What parts of our body are we moving? Arms, our legs, our heads. Did you have to think about anything? Yeah, not really. Like, you didn't have to think about maybe the stuff that was going on to you earlier this morning or the stuff that's happening later because you were fully immersed in the music. So cognitively, what you were thinking about was the task at hand. You were listening to the music. You were saying, okay, how am I going to move this instrument? Oh my gosh, this crazy lady I just met 5 minutes ago telling me to spin around in a circle while I'm playing my instrument. So those are the things that were taking up your brain space. What else was going on? Were you isolated or were you together? Yeah. So oftentimes in the hospital, you have one kiddo that is stuck in their room by themselves. Maybe they have family that can come in and out, or maybe they're in an isolation room and really the visitors are very limited. And so who they see are their doctors, their nurses, their caregivers, and maybe one or two family members at bedside. But you are by yourself, and that can be really isolating. So whenever we can, the music experiences can help bring people together. Look at that. So these are just a few examples of us doing music therapy at bedside and in the different group rooms at the hospital. The next slide is going to show you what we call as our functional domains. So putting your science brains back on, in the center you have your whole person. So like you as an entire being, and then all of these things around the circle make up your functional domains. Cognitive, we talked about, we did in that experience. Social, you are creating an experience together. Communication, if you chose to sing, you are singing along and communicating. Maybe you're communicating through your affect and through your motor movements. Physiological, those are the things that are going on. I didn't have any probes or anything on you to measure your heart rate, your oxygen rate, and your blood pressure, but we'll get to those later and seeing how the music affects that. Maybe you're connecting on a spiritual level. Sensory, the vibrotactile vibrations of the instruments, the sound from the guitar coming, you can often feel that. Emotional affective, we were talking about that. You were brightening, smiling, laughing, and then back to our cognitive. So I'm going to tell you a little bit about how we function with music therapy. So what is music therapy? The easiest thing to tell you to start is what music therapy is not. So music therapy is not an entertainer that goes to bedside or goes to meet people and plays instruments just to have fun. Music therapy is evidence-based in research, and we are working alongside of your medical professionals, your other therapists, your occupational therapists, your physical therapists, your speech therapists, and we are working on individualized goals based on what you need at that moment. So a lot of times in the hospital setting, this can come from doctors or other medical professionals in your team. You know, I can have someone at bedside, maybe they just had surgery and they're having a lot of trouble moving their arms and legs, or it's painful. So I might take in instruments, and all of a sudden we're playing and engaging with the music and reaching above or reaching to the side, and they get to choose, and all of a sudden we're getting those functional repetitive movements back into our arms and legs, whereas before all we wanted to do was lay in bed. So evidence-based practice, two of our big journals that we have in the music therapy world are the Journal of Music Therapy and Music Therapy Perspectives. However, music therapists often publish in other publications, nursing journals, pediatric nursing journals, pain journals, based on whatever their research is in. Talked about functioning, our motor development, physical development, as well as your emotional wellness. Again, it all comes back to whatever the specific needs are of that patient at that time. The big thing that we will talk about too, a lot of people say, why not just turn on a CD player? Why not just have them pull up their phone and listen to music? The key about music therapy is it's about that relationship that is built between the patient, whoever's receiving the treatment, the therapist, the board-certified music therapist, and then the music. So it's all about that relationship and the connection that is between all three of those areas. And if you just turn on a CD player, you're missing a huge piece in that social connection, being able to work together. So that's why we don't just put on a CD, and you can't manipulate the music. A lot of times in the hospital setting, I'm really working with a patient to help with their heart rate, their oxygen rate, their respiration level, and if something goes wacky in their vital signs and I just have a CD playing, I can't change that in the moment. But if I'm there at bedside with my guitar and manipulating my voice in a certain way, I can help with those vital signs right away. So, it's a little bit about music therapy. Now, music therapy isn't just in the hospital. What happens in order to become a music therapist is you go to a degree program in college, based in an AMTA-approved program. So AMTA is our national organizing body. It's the American Music Therapy Association, and they'll accredit schools. So you can either choose to do a bachelor's level program or a master's level program, including an internship. And that internship comes out to 6 months full time. So you do your 4 years of school in undergrad plus the 6-month internship. Or you can choose to have your undergrad in something else and do what's called a master's level equivalency program and an internship. So those are kind of the two paths that music therapists take. You can practice as a music therapist board certified with your bachelor's degree. It just depends on what you choose to do. Once you finish all of that schooling, you have to sit for your board certification exam, and that's really important because that's the exam that says basically you know what you're doing or you don't know what you're doing. And you want to make sure that whenever you're receiving music therapy services that you're getting one from a board certified music therapist. So that cycle then lasts for 5 years. Within that 5 years, you have to be getting continuing education and different things to keep your skill set up. And if you don't take continuing ed, you have to retake that test every 5 years. So music therapists work in a whole bunch of different settings, not just the medical setting. This is just an overview of where we work. We can work in psych hospitals, we can work with behavioral settings, we can work in early intervention programs in schools with older adults, in nursing homes with dementia. We can work in private practice, so sometimes music therapists have a business out of their home or out of a center and contract music therapy services, community-based programs, and also rehab programs. So there's really quite a variety depending on where your interests are. There is a lot of research to support all of these different areas. So why music therapy? So music therapy provides a whole bunch of opportunities in all those domains that we talked about earlier, as well as expanding the scope of patient and family-centered care. And what that means is we are addressing both the patient and the family to help make their experience better, as well as to be able to work interdisciplinary with other disciplines. So sometimes I'll work with a child life specialist and bring them into the room and incorporate them into the treatment. Sometimes I'll work with a nurse and then they're incorporating the treatment, especially if a child is really scared of their nurse or their doctor, to bring them into this session and have them creating music with us can really normalize the hospital experience and make it less scary for the kid. We can work solely with the patient and the family as the primary therapist, or we can co-treat with those other professionals, whether it's physical therapy, occupational therapy, and speech. And what's really neat when we're co-treating is, I can talk to my OT colleague and say, hey, what are you working on? And maybe they're working on fine motor skills so that the kid can eat again by themselves. And then what I can do is I can bring in my smaller instruments, and we can be working with those fine motor skills through the instruments so that those goals can then translate to what they're working on in occupational therapy. Again, with that social domain, sometimes we're working with them individually with their family and bringing everyone into the room. And sometimes if the kids aren't on isolation, we can bring them out of their room into a group room, and then they can see that they're not isolated. They're not the only ones in the hospital with their diagnosis or who has to get IV sticks, needles, different things so that they're not alone in their setting. So now we're going to get into a little bit of the science. Like, why does music therapy work? Why are we not just using only physical therapy, only occupational therapy, only speech? Why this music component? So music primes the brain. And what that means is you can use music as a cue. Like, if I sing, take me out to the, your brain automatically is going to say, oh, ball game. Maybe I say basketball game, but it's ball game. Your brain is there, it knows, because that song is highly repetitive and it's structured. So our brain starts to form these connections. And with kids in speech and function and motor movement, a lot of times I'm using that repetition in the song to get them to do something, whether it's say something, move a certain way. With our little kiddos, Old MacDonald is like, gold, really, because Old MacDonald had a farm, E-I-E-I-O, you sing that how many times in the whole song, and those E-I-E-I-O's are really great with starting speech sounds, and then when you're using the different animals, I can bring in different props, and can you find the cow? So then we're working on a cognitive skill, and then we'll be working on a speech skill and a functional skill as they go to reach the animal. So all of these things are tied into the music because of what the music is doing in your brain. Again, that evidence-based practice. This isn't just me walking into a room saying, I think I'm going to use Let It Go from Frozen today, or I'm going to use, All the Raindrops Were Lemon Drops and Gumdrops. I'm going to the research and saying, what is working? Who has found out this helps with motor, this helps with speech, this helps with cognition? I'm going back there and using that research to inform my practice. The other thing about music is it's fun and it's motivating and it catches your attention. And there's so much research that shows that when you give people back their choice, especially in the hospital setting, so much is out of your control. We gotta come in, you gotta take your medicine, you gotta have the dressing change. If I can come in and say, hey, what kind of instruments do you want today? What kind of music do you want to listen to? We are giving the child and the family back that choice, which is oftentimes not able to happen in the hospital. So that's where the motivational and fun piece happens here with music therapy. So more things about the brain. Music is in all of your brain. We used to just think it was only one side of the brain and that's where the music center lies. Well, what we found out is that music crosses so many areas of your brain and specifically is a part of the limbic system, which again is going to affect your affect, how you're brightening, or maybe if you're staying flat that day, as well as your physiological response. We're going to talk about how the music affects your heart rate, your respiration rate, your blood pressure, and how that then in turn enhances pain control. And pain control is huge in the hospital because when your pain isn't controlled, you're not able to meet your other goals. Because think about any of the times that you are in pain, it's really hard to want to do anything. And then you need more medicine because you're in pain. So if we can stop that process and help to get the pain under control with something other than medicine, we're able to help them get moving quicker and start to reach those other functional goals. Very specifically, tempo and rhythm can help stimulate movement and help to really affect your heart rate, respiration rate. So one of the things that I will do in the hospital is something called sedative guitar. And sedative guitar is based in 3/4 time. So that means your basic lullaby, your waltz, 1, 2, 3, 1, 2, 3. Because as that repeats again and again and again, your body starts to entrain to it. So I play about 60 beats per minute, just about 3 or 4 chords on the guitar. And I play this over and over and over again. And it's simple, it's repetitive. And what I can do is I can watch the monitor while I'm working with the patient and see, okay, where's their heart rate at? The reason we pick about 60 beats per minute is 60 to 80 beats per minute is a resting heart rate for teens and adults, and about 120 is the resting heart rate for a kiddo. So half of that brings you back to your 60. And what we find time and time again, and the research supports this, is by me being able to come in with this music and match where they're at and use this entrainment process, we can see their heart rate come down, their respiration rate come down, and that's how many times you're inhaling and exhaling. So if that comes down, your heart rate comes down, your O2 levels, your oxygen that's actually circulating in your body can come up, and then you actually are relaxing. That helps with pain control, relaxation, calming, all by using the music to entrain your body. So, this is just just another example of music therapy in the hospital. So, this is our medical music therapy treatment tree. This was established by my colleague at the hospital, Jan Stauffer. You can see her at the bottom. But this is how we structure and how we prioritize in the hospital. So if you start up in that upper left-hand corner, the very first thing that we are focusing on when we go in to assess a patient is for pain, anxiety, and sleeplessness. Now this is for all patients in the hospital, not just the pediatrics. Because if that is not controlled, we can't meet any of these other goals. So in order to meet pain, anxiety, and sleeplessness, we can use music-assisted relaxation. We can use music-focused distraction, and sometimes we're also working on managing end-of-life care in the hospital. We'll get into each of those domains a little bit more specifically as we go throughout. So maybe your pain's under control, then we can move into emotional coping. And emotional coping can include a whole bunch of different things. Maybe that's starting to express how you're feeling about the hospital situation. Maybe that is going in and being able to express, you know, this is not where I want to be, or these are the goals I want to reach, and this is the support I have. Being able to express that through the music. Functional skills, we talked about speech, motor development, and then that last piece is meaningful adaptive leisure. And what that is that's giving the patient and the family the tools and the skills for things that they can do in the hospital, even when we're not there. So things that are meaningful that they can do in their time. Sometimes kids want to learn an instrument. Sometimes they want to create their own digital projects. Sometimes they want to write their own music. So that can all fall under that meaningful adaptive leisure piece. So coming back to that pain, anxiety, sleeplessness, that's the very first category that we're working on. Music-assisted relaxation is using what I did with the guitar over there and using that 60 beats per minute sedative guitar in order to decrease your heart rate, your respiration, your blood pressure. The other thing that we can do is do passive music listening. So maybe I go in and someone doesn't just want the guitar, but they're like, hey, I really love Ed Sheeran, or I really like Blake Shelton, you know, and I can take that music and make it low-key. I can adapt the music components, I can adapt the speed that it's played, and it's still their preference of music, but I'm taking the components so that their physiological responses are still the same. Lullabies or calming music, again, falls into that, as well as helping through procedures. So if you think about things that happen in a hospital, there might be IV sticks, there might be dressing changes. Dressing changes are that sticky stuff that they put over an IV in order to keep it safe. So every once in a while you need that dressing changed, and that can be painful and no fun. I've helped with EEG placements, so that's where they put all those electrodes on your brain, and that's really scary for kids, and often doesn't smell very good with the glue that they use. And you have to stay really still, so we can use the music as a distraction and support through those procedures, whether it's the kiddo is playing with their upper extremities or they're just listening. So all of these things we found in the research that, you know, those vital signs are able to decrease with your O2 increasing. You see relaxed tone, and what that is maybe if somebody's in their hospital bed like this, we see their tone relax, their muscles relax. And they're able to have increased sleep time and calm awake state. So maybe instead of being awake and crying and fussy and yelling, they're able to be awake and just calm. It also decreases that anxiety that may be coming up right before the procedure happens, as well as allowing them to focus on the music, like we had talked about in the beginning. Were you focusing on anything else? No, not really. You were in the moment with the music, and increasing distraction. So that's an example, just in a hospital. Levels of relaxation. These are all the different things that we can use for relaxation, whether it's distraction through actively engaging in music. So instead of just listening, you're actively being a part of picking up instruments, picking what you want to listen to. Song stories are a way to use the repetition in the music and also educate on what's coming up. And that I'll talk about at the end because we're doing some research on song stories in outpatient clinics, how music therapy can help with anxiety for that. You can also use music for quiet time and sleep time. For our older teens, adults, you might not want to be listening to Old MacDonald, really nice and quiet, or Twinkle Twinkle Little Star. So that's when I bring in their preferred music. Maybe it's the pop music. I've worked on sedative rap music, you know. I've also worked on being able to have them create the music for music distraction. The other thing that's really popular with our teens is creating a relaxation script. So I'll use that bass of the guitar, that 60 beats per minute, but also then talk them through a muscle relaxation. So I'll start with the muscles in your head and your shoulders and your abdomen all the way down to your legs and help through some prompts, the guitar prompts, and my voice can help them to release that tension. And then go into an imagery. So some people want an imagery of the beach, some people want imagery of the mountains or a meadow, and I'm able to create that within the music. Again, using the music for the sedation and the calming effects rather than having to use more medical sedation. So that next piece of emotional coping, this we infuse throughout our experiences. Sometimes this looks like active engagement. I walk in and I say, what instruments do you want to do today? We have everything from the teeniest, tiniest little like NICU baby shakers all the way up to a huge ocean drum for teens and something we call the happy drum, which is more of like a steel drum and you can do improv-based things, all the way up to tubanos. So it's something that even our teens get into and people your age in middle school and high school, as well as college students. So we're able to meet the music and the preferences for whatever they are interested in. And this can be self-expression because we're giving them choices. What do you want to do? Well, I'm feeling the tubano today, or I really want to learn some guitar. It's giving the control back to them in that moment. Also, sometimes we do digital music making, like through GarageBand on the iPad, and we can use that as a platform to express your thoughts and feelings. So maybe through the music, you know, you're able to say, you know, this is how I'm feeling. And you play something through the melodic instruments and the percussion instruments, and we're able to process that. Like, oh, I heard you playing really loud. You know, how are you feeling today? Or what made the music loud today? Your music's really soft, it's fast, it's slow, and being able to use those music components as cues for the emotional coping. The other thing that music does, especially if there's difficulties with language barriers, is being able to communicate with people through the music and still have a meaningful experience, even if you don't share the same language. Functional skills, we talked a lot about this domain, and you can still infuse emotional coping even when you're working on these functional skills. So I might have the lollipop drum. Someone had the lollipop drum. Ah, there it is. Or a big frame drum, and I might say, which drum do you want to play today? And then through a song of their choice, maybe we're reaching up high, reaching to the side, you know, maybe we're walking through the hallway and creating a parade. You know, for my kiddos that need to get up and out of their room and they're like, no, I don't want to do it. We're like, okay, let's make a parade. We include the nurses, we include the doctors, you know, and they're leading the parade. They get to decide what song it is. I mentioned Let It Go earlier because Let It Go is still popular. So we've done parades and different things like that with their song of choice. The other really big component, and some of you may have seen this in the news and different things, is our neuro-music therapy rehabilitation with like Gabby Giffords. She did a lot of her own music therapy in the hospital for speech and stroke rehab, and we see this with accidents, with big times when people are hurt and lose their functional skills. You're able to use neuro-music therapy rehab, and there's even a special certification that you can get called your NMT to really get specific in those skills. The other piece is working on music for respiratory activities. So whether you're singing, whether you're playing a wind instrument, being able to regain that strength in order to breathe and have that sort of function. So that last piece of meaningful adaptive leisure, being able to find something that is important to you that you can create and you can have meaning for while you're in your hospital experience. Sometimes that's learning an instrument, sometimes that's taking technology and rewriting your own song, whether it's writing the music or writing the words. And that can be really indicative even back to emotional coping, of being able to say, this is what's going on for me, and now I'm able to create it and put it into my own music. And that's really, really valuable for the patients and their families. So things that we want to consider across the board for music therapy is meeting that patient as an individual. So there is never a time where I will go into a patient's room and give them the same exact treatment as a cookie cutter, the next person, this person, that person, because every person is individualized, whether it's their diagnosis, their cultural background, who they are as an individual, what they like, what they don't like, what are their goals. So each time I walk into a room, I am assessing that patient and saying, what can I do for you as an individual? So I can really incorporate their preferences, their cultural background, their preferences, which is why I have to be so versed in different kinds of music, but also know that it's okay if I say, I haven't heard of them before, tell me more about that, and give the patient the opportunity to teach me something. Also in the hospital setting, you have to be aware of like sensitivities, precautions. Maybe they're really sensitive to certain vibrations, certain sounds. So in that case, maybe I don't bring in the kabasa if it sounds very grating, or maybe the guitar isn't working and we're just using our voice. Again, thinking about live music versus recorded music versus pre-recorded music. We have some of our sedative guitar and music-based relaxation experiences that we have recorded because we know, okay, it's at 60 beats per minute, we're controlling the music. But we also only give those out if we've tried with the patients or we know that they're going to be okay with that music, because we don't want to do anything that would be harmful in that moment. Sometimes we experience the music free field, so we're playing it out loud, and sometimes they're listening to it on their headphones. So it just depends on the situation and what works for them. So a little bit about the research that I've been working on, along with a bunch of colleagues in the field, is using song stories for children's coping, knowledge, and anxiety during outpatient procedures. So what that means is IV starts when you're getting an IV placed, those dressing changes, and port accessing. And port accessing is a more permanent way of accessing for blood draws and different transfusions. So talking a little bit about that, we have a whole bunch of literature that was consulted in order to be able to say, why are we doing this research? Why is this research important? And we can see on the screen that this story and study was very significant because there's so much need to be able to say, well, children are stressed, they're anxious, they're scared when they're coming into the hospital. How can we decrease that anxiety? And in previous studies, we found that music therapy decreases anxiety in patients. There's a whole bunch of people that share that. And it also decreases anxiety before, during, and after different medical appointments. We're also looking on how can we educate our patients. Does that play a role in anxiety, pain management, and coping? And other music therapy research has shown that we can actually infuse coping skills in that. We also wanted to see song stories to teach tasks and cognitive concepts, like would it be effective to use a song story to teach about what's coming up in their procedure, in their IV start, in their dressing change. But what we found is that there's not much research already using song stories, so that's why this research became important to use. Because we want to see our song stories decreasing anxiety, increasing coping, and increasing understanding. So on this next slide, you'll see that we were able to review a whole bunch of literature in preparation, just like we were doing earlier for the significance of the study, that even in medical settings, there are all these different areas where we found decreased anxiety was successful through music therapy, through all of these different techniques. So what we decided to do for our research was we took all this literature that was already done, as well as the holes in the literature about song stories, and we said we want to develop song story scripts that prepare children for their IVs, their dressing changes, and their port accessing, and to see, does giving these repetitive stories with infusing coping skills in them, does that help to be able to have a more positive experience before their procedure? So this research is still in the works. We're hoping to wrap it up, hopefully by the end of this year, and get it published. So all of that review of literature, as well as the procedure and the different measures that we used, hopefully, stay posted, will be updated. So we can see through these. So in conclusion, there is so much that music therapy can provide, both by itself and with other professionals. So we use that research that is already there and participate in research in order to provide the best treatment for our patients and families, meeting individualized needs, goal areas, assessing that patient every time to make sure that we are meeting their needs, as well as incorporating all those domains, cognitive, social, communication, functional, all of those different things into their treatment. Bringing back together that patient and the family and normalizing the hospital environment, as well as working together with your team wherever you're at to be able to best meet those patient needs. So I left a little bit of time to see if you had any questions or had anything clarifying either about music therapy, the hospital setting, music therapy in other places, in general, the research that's already out there. So if there's any questions. Has anyone ever heard about music therapy? Go ahead.
What is your favorite type of music?
Oh, you know, I'm asked that question all the time. I truly listen to all kinds of music, and it depends on my mood. If I'm cleaning in my kitchen, maybe I'm listening to classic rock. If I'm out dancing, maybe I'm listening to country music. Or if I'm in my car, maybe it's summer hits of the 90s, who knows. But I really do listen to it all. One of the things I've learned to appreciate even more as a music therapist, because I always listen to a variety, but I definitely have more favorites, is just the musicianship and the musicality really in all different genres. Even if it's not my go-to genre, being able to find what makes each genre, each artist special. My clients have shown me that.